All right, well, hello and welcome everyone to the November meeting for the Rural HPV Vaccination Learning Community. On behalf of the American Cancer Society and the National HPV Vaccination Roundtable, I want to thank you for taking time out of your busy schedules to join us today, whether that's live or via recording in the future. Today will be the the third session that we can offer both live and enduring CME and CNE credits, which we will share here in the chat in just a second. And today's meeting will be really focused on exploring alternative vaccinators and settings to HPV vaccination. You get to hear from a really great panel of alternative vaccinators in ways that they are working to increase HPV vaccinations in their roles and settings. If you want to go to the next slide. So I'm Ashley Locke. I'm an HPV program manager here at American Cancer Society. I have the privilege of talking with you today, but I am joined by several other colleagues who work to increase HPV vaccinations every day. Next slide. So in the spirit of Thanksgiving, I thought we could do a quick icebreaker. So please feel free in the chat to share your name, organization, and what you're bringing to Thanksgiving dinner. So please feel free to do that. And then next slide. So while you guys are adding into the chat your name, organization, and what you're bringing to Thanksgiving, I'm going to just share a roadmap for today's call. So in just a minute, I'm going to quickly review what we mean when we're talking about alternative vaccinators and settings. And then I'm going to help moderate a really robust panel of individuals representing alternative vaccinators who are going to, share their experience and share how they're working to improve HPV vaccinations in their roles. But before we get to the bulk of today's session, I do want to share a few quick reminders for you. So all of our rural HPV vaccination learning community sessions are recorded and are posted to a public-facing website. This session is certified for CME and CNE credits, and my colleague Gabby is going to add into the chat a link where it will detail out information for obtaining those live CME and CNE credits. You can also find this information on our website, and just want to note that none of the planners, speakers, or panelists for today's session have anything to disclose. And we ask all participants to stay muted until our panel discussion. However, in the meantime, we do have the Zoom chat open for questions and support. So please feel free to use it. If you want to go to the next slide. So as always, both the American Cancer Society and the American Cancer Society's National HPV Vaccination Roundtable take a systematic approach to our quality improvement framework. And so this slide in particular showcases the different steps that we and our partners are doing not only to improve HPV vaccination rates, but also cancer screenings. And I know we've been on this particular step for a while, but we are going to continue to explore evidence-based interventions more in depth. If you want to go to the next slide. So we do have several polls throughout today's session, but our first one is really to find out your knowledge and share some collaboration that you have done with alternative vaccinators. So I'm going to go ahead and have Gabby open that up. And while you guys are doing the poll, I am going to share a little bit more about our learning objectives for today's session. So we are going to be describing how to increase on-time HPV vaccination rates in rural communities, comparing best practices and challenges in increasing HPV vaccinations in rural settings. So those are the two that we'll be focused on. And just looking at the poll, it looks like we've got 36% participation, so love to see a little bit more. We are going to be asking these same questions after the didactic and the panel today, so get ready for that. .61% participated. If you are just joining us, we're doing a quick poll just to rate your knowledge on what it means to be an alternative vaccinator and to be providing HPV vaccines in alternative settings, and then also which alternative vaccinators you might be currently collaborating with. So would love to see a little bit more participation. We're at 64%, hoping we can get to 70. All right, well, it looks like we got to 70%. So we can go and end that poll, and I will just share it out with everyone. So it looks like majority are either moderately or slightly knowledgeable. We have some that are very knowledgeable and extremely knowledgeable, some that are also not knowledgeable at all. So hopefully today's discussion will help you gain some knowledge. And it looks like some of you are working with dental providers, urgent care and minute clinics, pharmacy, school-based health. Some of you are not working with some at all, and some are also working with some others. So great information. Thank you all for participating in the poll, and look forward to continuing to talk about this. So what does it mean to be an alternative setting in vaccinator? So alternative settings in vaccinators are defined as anything that's really considered outside of the medical home or primary care setting. Examples include the following: dental offices, emergency services, which includes EMT, EMS, paramedics, urgent care and minute clinics, pharmacy, school-based clinics, specialty services, OBGYN, Planned Parenthood, and there's so many more. If you want to go to the next slide. So what are some of the advantages to alternative settings in vaccinators? So first and foremost, the US President's Cancer Panel actually endorsed alternative vaccination settings as a promising practice and way to increase HPV vaccine coverage in the US. So that's really exciting. Most adolescents attend at least one healthcare visit a year, but many of these visits are considered acute care, where vaccines are rarely discussed. So that's why, having opportunities with alternative vaccinators is really key. Nearly half of US children ages 12 to 17 do not have reliable access to comprehensive primary care, and very few primary care providers serve some of those rural and disadvantaged urban areas. And so that's one reason that adolescents from vulnerable populations, are less likely to receive that consistent primary care. Obviously, there's a need for multiple visits to complete the HPV vaccination series, which really amplifies these problems. And another really great advantage is that parents are really open and accepting to getting vaccines in alternative settings and from alternative vaccinators. So lots of great things, lots of great advantages. If we want to go to the next slide. So just some things to consider as you're working with alternative settings and vaccinators. Obviously, there maybe some issues with maintaining appropriate vaccine supply, which could result in missed opportunities, or it could really be an overabundance of unused vaccines. So keeping that in mind when you're working with them. Vaccine storage may be an issue, administration costs. There's also insufficient insurance reimbursement, which is definitely something to consider. Possibly insufficient vaccine administration training, so VIS and consent to vaccinate, and then lack of interest from staff, and then also dealing with the vaccine hesitancy that comes from providing vaccines and maybe not having the proper training to overcome some of those hesitancies. Obviously, there also could be trouble accessing vaccine records from the state immunization system, and then also could create record scatter if an individual is getting vaccines from multiple places. So just some things to consider, but want to move into our panel so we can hear from some of our alternative vaccinators today. So hang on one second here. If you want to go to the next slide. So we have a really wonderful panel of speakers who are going to share their knowledge and experience around alternative vaccinators and settings to HPV vaccination. So I'd like to welcome Debbie Chalmers. She's a clinical dental hygienist at Greater Portland Health and an adjunct clinical professor at the University of New England. Bridget Groves, who's vice president for professional affairs at the American Pharmacists Association. Sandy Hartman, Associate Director for Community Partnerships at the American Cancer Society, Josh Pava, CEO at Colovax, Jessica Reed, Clinical Quality Manager at Maine Medical Association's Center for Quality Improvement, and Karen Schwind, Retired Director of Health Services at New Braunfels Independent School District, and immediate past president for the Texas School Nurse Organization. So I'm going to ask that we spotlight all of our panelists and we can start from there. Perfect. All right, so I'm going to have each of you share a little bit more about who you are and what you've done in your profession and setting to increase HPV vaccines. So I'm going to go ahead and start with Debbie.
Hi, everyone. Again, my name is Debbie Chalmers. I'm a registered dental hygienist in the state of Maine. And I just wanted to make sure you can hear me okay, right, Ashley?
Yep, we're good.
Okay. I've been starting to get a little glitchy, so please let me know. Do you mind just asking the question one more time?
Yeah, if you could just introduce yourself and some of the ways that you are working to increase HPV vaccines in your role.
Okay. So what I've been doing, I came onto a project and with Jessica Reed, who you all will meet. I was their dental expert for this project to increase vaccination rates in the dental chair, dental clinic. So during the project, we were educating practices, both medical and dental, and some FQHCs as well as some dental private practices. We also went into the schools to educate the students about HPV and the vaccination and awareness and how to initiate these conversations with their patients.
Perfect. Thank you, Debbie. Because you're connected with Jessica, I'm going to ask you to go ahead and introduce yourself.
Thank you so much, Ashley. Thank you, Debbie. Hi, everyone. My name is Jessica Reed. I am the Clinical Quality Manager for the Maine Medical Association Center for Quality Improvement, also a gerontological nurse practitioner by trade, and happy to be here with you all today. HPV has definitely become, vaccinations have become a personal passion of mine, and again, just have been involved in developing multiple HPV learning collaboratives and HPV Echo project, and most recently, the 2-year project that Debbie alluded to, which was the HPV vaccination dental project. And again, happy to share more of that with you during this call. But again, happy to be here.
Perfect. Thank you, Jessica. I'm going to have Josh Pava go ahead and introduce himself.
Hi, everyone. My name's Josh. I work with Colovax. We do mobile vaccine clinics. So by my background, by trade, I'm a paramedic. I did public health work in the Army for about 12 years. And long story short, when COVID started, we started doing mobile vaccine clinics. And more recently, we're doing, I guess I don't want to get ahead of myself. That's probably a later question.
Perfect. Thank you, Josh. Bridget, if you'd like to introduce yourself.
Yeah, well, good afternoon, everyone. It's really nice to be with you all. My name is Bridget Groves. I am a pharmacist by training. I'm our Vice President of Professional Affairs at the American Pharmacists Association. In my former role before coming on board here as a staff member at APHA, I actually did administer vaccines in community-based settings, so your typical pharmacy locations. And I was also in pediatric primary care where I worked closely with parents and caregivers alongside our other medical team members to help dispel a lot of the myths that were out there around HPV vaccination, unfortunately. So really excited to be with you all today. As far as my current role, I help to assure that our pharmacists and pharmacy technicians have access to the information and resources to them to help assure that they're being able to provide, recommend, and administer vaccines in a variety of different settings and ages across the United States.
Perfect. Thank you, Bridget. Sandy, would you like to come off mute and introduce yourself?
I'm Sandy Hartman. I'm with the American Cancer Society, and I am based out of Reno, Nevada. So in my professional career, I was actually a community health worker by trade, and then managed a team of community health workers. And so I've done a lot of work in the HPV setting with the community health workers at the federally qualified health center that I worked with. We had a lot of outreach that was done with the School of Public Health in Nevada as well. And then in my current role, I work specifically with federally qualified health centers on various quality improvement projects. And so we worked on a 2-year quality improvement project focusing on HPV over the last 2 years. Some of our health systems have continued to work on that. And then most recently, I've worked on an HPV Echo series. And so the HPV Echo series has worked on educating community health workers on being HPV champions in alternative care settings as well.
Perfect. Thank you, Sandy. And then Karen.
Thanks, Ashley. Hi, everyone. I'm Karen Schwinn. I'm a registered nurse and a nationally certified school nurse. And I have just retired after 28 years in school health in Central Texas. I became involved with HPV as a personal passion, but also as awareness for school nurses, because there were so many that I would meet that were not aware of the need for administering HPV. So I began a mission, joined the Texas American Cancer Society Coalition for HPV, and have been attempting to educate as many as I can along the way. Most recently was presentations to conferences and an echo series that we specifically focused on educating the Texas school nurses. Thanks for having me today.
Perfect. Thank you, Karen. So as you can see, we have a really robust panel of alternative vaccinators, and so would love to get a little bit more in depth and having each of you guys share just different ways that you personally or your profession could become more involved in increasing HPV vaccines. So, Jessica and Debbie, do you guys want to share a little bit more about what you've been doing with dental professionals and increasing HPV vaccines?
Sure. Debbie, you want to lead and then you want to jump in?
Yeah, please.
Oh, good.
Yes.
Okay. So the project was a 2-year project. We started in August of 2021 and wrapped up in August of 2023. And because of the learning clubs that I had done in the past, I really felt that there was an incredible place within the dental clinics to provide training and have them promote and educate their patients on HPV vaccinations. And so in putting this project together, FQHCs seem to be that perfect place because also of the co-location, with FQHCs, right? They have the medical and dental clinic, they share the same EHR. It's like a match made in heaven. And so we started there and then worked with 2 community dental practices and a private practice. And one of the things the FQHCs, and really we can't take credit for this was something they did on their own, but they developed an entire workflow on identifying patients who were due on the dental side of things, who were due for their HPV vaccinations that were coming in around the prerequisite planning process, and would talk with them. Again, we did education, prep them, and I'll have Debbie talk a little bit about that importance of doing that training from her perspective. And then what they would do is have an MA carry a phone. And so once they would talk to the patient and family about the HPV vaccine, and if they were on board, they would call that MA, would go into the state registry, double check, bring the consent form, bring the vaccines, and actually be able to administer HPV either in the dental chair or in a separate place in the dental clinic. And that was amazing. And then the second piece, it just actually grew because they were like, well, we can do more than just HPV vaccinations. We can do any vaccinations that they're due for, right? Because we want to meet every opportunity that we can, knowing that these kids sometimes in the adolescent age may see their dentist more often than they would their primary care. So, and then the second year, they mentored another FQHC to set up the same practice. So that's just a little component of that. And Debbie, I'll have you just from the dental perspective about, the conversations and what they thought was going to happen and what didn't happen with conversations.
Yeah, so we did during the training, we would do a 1-hour kind of kickoff, and then we would do another additional training just to go over how to initiate conversations. In dentistry, I mean, just the dental hygiene side, we're educated on, oral lesions. We can't diagnose, but anything that's abnormal, we're always taught to, let our dentist know and refer out. So we give that base knowledge of HPV from, the basic of what it is and what the vaccine does. So during those educational pieces, we added onto, some little tidbits about like adding it onto their medical histories and asking the parents, about the vaccination status. Which there was a little hesitancy because again, I got into dentistry not to talk about, an STI or STD conversation, but we're changing that thought process as it's more of a protection against oral cancer piece. So you don't even need to have that discussion with the parents. So there was some hesitant about it. And during the conversations during the project, we had no pushback from any parent. Because we were focusing on, that age range between the 9 to 26. So that was really eye-opening because the patient's parents actually expected us, to kind of ask these questions about their child's medical history, not necessarily just dental wise focusing. So, it was really good to have that support, knowing that there wasn't going to be oh my gosh, you're the dentist. We're not supposed to be talking about an STD or STI. So, that was great. It was, the practices that we worked with just took the information and ran with it,
Perfect. Thank you, Debbie, and Jessica for sharing more about your guys' project. We'll get more into it here in a second because I think there's a lot of opportunity, right, with dental providers. But Bridget, I'd love for you to share more. I know you had shared that you used to work in a community pharmacy, but where do you see opportunity when it comes to pharmacists and HPV vaccines?
Thanks, Ashley. There is a lot of opportunity. I think, especially when we consider different rural areas, as you are all in that space much more frequently, you can recognize that there's not as many healthcare providers or options for a lot of your patients to receive care. So I'm actually really thrilled to be on this panel and to see so many alternative options and ways that we can mutually work together to increase rates of HPV vaccine. And hearkening to one of my colleagues, as I mentioned, we're really trying to increase rates of all vaccines as well. So pharmacies, as many of you know, are very accessible. We have an oft-quoted statistic that almost 90% of the American population lives within 5 miles of a pharmacy, which makes things pretty nice convenience. If you also think about the hours that they might have, they might be open longer hours than other institutions, other offices, which are nice for parents and caregivers who might have, work schedules or other items. It's also convenient because you can think about the fact that they can bring a family in and bring multiple children or others and have that opportunity to vaccinate for a couple of different things kind of in that moment, offering both walk-in availability as well as appointment-based. One of the things that we've seen to be really successful, though, is having some of those partnerships established between that local pharmacy and whether it be a school or a pediatrician's office, for example. We've seen that to be a really helpful way to kind of refer and make sure that those patients are getting what they need, especially if you think if that child is coming in for that visit, their annual well child visit, they got their first dose of the HPV vaccine, they need their second dose. Maybe it's more convenient for mom, dad, or grandma to go into the pharmacy to get the second dose. Our pharmacists are pretty consistent about updating the state registries, and when they're the political stance is allowing them to do so, and making sure that information is there, as well as instead, sending a fax or other notification to the primary care provider office so that they can update their internal records accordingly to make sure that we're tracking and we're not over immunizing, but we're meeting what those needs might be. So we've seen that to be really successful when you have some of those partnerships between school-based clinics as well as the pediatrician offices. and kind of that warm handoff between the clinics and the pharmacies for this age group in particular.
Perfect. Thank you so much, Bridget. And we'll get more into pharmacy here in a second. But I'd love to hear from Josh. Josh, I know you had shared that you are a paramedic by training and would love to hear a little bit more about, what you're doing to increase HPV vaccines and where you think there's opportunity for emergency services.
Yeah, absolutely. So kind of two separate projects I work on that both are related to this. I'll start with the quicker but shorter and exciting one. So most fire departments and EMS services nowadays carry blood products. And I bring that up because that means they have to have in their supervisor vehicles a little portable Varicor or some sort of temperature controlled device that keeps everything between 2 and 8 degrees Celsius, which conveniently is the same temperature we have to keep HPV vaccines stored at. So we've been working with some EMS agencies and fire-based systems to have their community paramedics, which in some states are kind of like an advanced practice nurse. They have limited prescribing capabilities, that type of thing. But we've been working to have community paramedics and other EMS providers can bring vaccines with them, can provide routine vaccinations. And the target audience for this is generally what colloquially, well, let's call them high frequency 911 users. And that tends to be where they spend most of their time is preventive care for high frequency 911 users. But we've also experimented somewhat with doing this even on routine calls where if you have a routine call with someone in the appropriate age range, you just have the conversation if there's nothing else going on and bring up vaccines. And there's certainly some hesitancy depending on the provider, the system, the state you're in, that type of thing. We worked all across the Southwest and, convincing people to do this in Colorado, for example, is pretty easy. Trying to do it in Oklahoma is a little more challenging. But we've had pretty good success working with EMS systems and EMS providers. And at our mobile clinics that Colovax does, we actually just employ part-time EMTs and part-time paramedics when they're not on a 911 shift, when they're not at their regular EMS job. We use them as immunizers at our clinics across the Southwest, and we've encouraged local public health agencies and state public health agencies that we work with to do the same thing in states that allow it, which again is a surprising number. A good chunk of the US, especially in the Southwest and the Northeast, does allow a number of different clinicians, including paramedics, to provide vaccines, which is super helpful. Does that answer your question?
Yeah, definitely. I think there's lots of opportunity. Josh, I don't know if you have a source available, but where we might be able to find if our state allows, paramedics and EMTs to vaccinate. If you want to throw that in the chat, that would be great. But we will get more into where there's opportunity here in a second. I'm going to have Sandy come off mute and just share a little bit more about community health workers and where you see opportunity when it comes to HPV vaccines.
I think really just touching on what Bridget said is using your pharmacist. So a community health worker is obviously not a vaccine administrator. They're not going to be able to administer that vaccine, but they are typically the referral source. So they are the ones that are out in the community. They are working with the patients. They're working on transportation needs. They're working on their barriers to care. And so really identifying resources around them. So like in a state like where you're at, Josh, being able to refer them to those vaccine clinics. So a community health worker being aware of all of the resources around them and then how to connect them over. And then also working with pharmacists on different settings. So for example, one of the clinics that I work with, they do a lot of back to school vaccine clinics. And so they go to different schools and the community health worker is there and they are providing this extra education as well. They have resources, they have pamphlets, they're having that one-on-one education. They do them oftentimes at community health fairs. And so they're often talking to patients, they're talking to families, they are very trusted by their community. And then if there's an administrator on site, they could say, hey, why don't you go over here to this booth? or go over here to this stop and you can get your vaccine there. And so I think the community health workers are key because they gain that trust, they have that rapport with the community, with their patients, and then they can then refer them to the sites. I think something that's also really convenient is a lot of vaccine sites or pharmacies have apps or have places that a patient can just go ahead and sign up, schedule their appointment. So that's something a community health worker can do at events where an administrator may not be there. And so that they're actually closing that referral loop is making sure that they help them schedule that appointment as well if there's that online resource.
Perfect. Thank you, Sandy. And then Karen, as a previous school nurse and just with all your experience working with school nurses, where do you see the best opportunity when it comes to school nurses participating in HPV vaccines?
So Ashley, I really look at it in a couple different aspects. One of those being what Sandy mentioned, and being that referral. School nurse records are valid records. So the school nurse has the access not only to the immunization registry, but also the record that the parent has provided from birth. So it's a great opportunity for meeting with students as well as meeting with parents and sharing the importance of the vaccine. Another way that school nurses can really be beneficial is in collaborating with either a local school-based health clinic. I know many of you mentioned that you're familiar with vaccines being administered at health clinics, but not all communities and states have those. So either collaborating with them and providing some on-site vaccines at school, possibly as a back-to-school option, collaborating with the local public health, a program like Josh's, or any type of a vaccine provider would be a great opportunity. Again, school nurses are trusted, parents respect them, and being able to communicate the information to parents is really key.
Perfect. Thank you, Karen. So I'd love to get into a little bit more about how we can start these collaborations. So, many of us on the call, aren't typically working in alternative settings. So if we were wanting to partner with an alternative vaccinator, what would be that first step? So I'm going to go ahead and throw that to Josh first, and then work our way around each of our panelists.
Oh, that's a great question. So that can be really challenging, right? So I think at some point you just gotta, if you already have an existing network, let's say you work for a local public health department and you already have a strong relationship with your local EMS agency, then that certainly makes things a whole lot easier if you already have those relationships. On the other hand, we frankly just did a whole lot of cold calling. We reached out to different counties, different states, different EMS agencies, different fire departments, and the success rate is not great when you're just cold calling people you don't know for sure, but we did have some success, enough that I think we've given HPV alone. I pulled the numbers before this call. We've given over 1,000 doses in the last 6 months. So we did certainly have success, but it's a whole lot easier when I'm calling people at a fire department I used to work with or a health department that I've worked with for years. Those established relationships certainly make it easier than just cold calling everyone around you and trying to see who's interested for sure.
Perfect. Thank you. It's always good to have that good old cold calling, right? So, Bridget, would love to hear from you. I guess what would be the first step in working with pharmacy on increasing HPV vaccines?
Yeah, excellent question. So first I want to draw attention, Tina just put it into the chat, but there is a hyperlink in there to, it's called vaccineconfident.pharmacist.com. On that page, we have just recently launched some maps that are specific for both public as well as healthcare professionals to use, and it helps identify different pharmacy locations. So I think that's probably step one, is identifying that pharmacy location that's nearest to the population that you're looking to serve or the area that you might be be representing or wanting to assure has coverage. You should be able to input a zip code or an address, and then it will allow you to kind of zoom into that area. And then depending on the different features that that pharmacy has, you'll be able to see, if they offer vaccines, if they need an appointment, if it's a walk-in basis. So I think that's probably step one, is identifying kind of where those are. As Josh mentioned, if you have a connection already with that local pharmacy, that's going to be a huge way to help build upon the relationship that you already have. Sandy's points around a community health worker. We have a lot of pharmacy technicians who, because they're from that community, they speak the language of the patients around them. They look like them. They're part of that facility. They're part of that community, have then sought to become a community health worker. And that's, again, another way to help build that relationship, whether it be with a community-based organization or a faith-based group, to assure that they're, being that source of that vaccine for those patients and in that area. If you don't have a good connection, meaning you don't have that already warm, established handoff, to Josh's point, a cold call is definitely worth it. We often see, especially with an independent pharmacy location, that you can call that pharmacy directly, introduce yourself, say you're from the community and you're looking to have some sort of relationship built. Our pharmacists, by and large, want to help to serve the patients in their community, and they would love to have that opportunity to be, partners in some of these initiatives and endeavors, and really working together and identifying ways that, if it's a back to school event, if it's sports physicals, if there's other places that they can be present in those moments. For more of the larger chain or bigger group pharmacy locations, it's certainly a great place to start by calling that pharmacy, but they might need to help facilitate with more of like a district leader, depending on what type of relationship and agreement might need to be put into place on the back end. So just anticipate that might take a little bit longer. Not that it's certainly something that we see quite frequently in many different locations, but know that just might have some of those additional conversations to go back and forth depending on kind of where that is. We saw a lot of relationships established and built with the different groups during the COVID-19 pandemic. We were really seeing some of that kind of capitalized on now. Like, we have this relationship built already. So now what else can we do to assure that we're protecting and meeting the needs of this community and really truly being where they are and meeting them where they are? So I think that's the final thing I would say, is if individuals had worked with pharmacies or pharmacy locations during COVID-19, kind of tapping back to that, and what can you do now to really, in this case, help to close a lot of the gaps in catch-up vaccines for kiddos that missed that during that time frame.
Perfect. Those are really great points, and good things to be thinking about as different organizations are going to work with alternative vaccinators. Debbie and Jessica, when we think about establishing a partnership with a dental provider, what might be the first step to doing that? And I know you talked a little bit about FQHCs, which maybe those are more established partnerships, but what would it look like, maybe to work with a private dental office?
So I would just say education. Education, 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 education. It all comes down to getting familiar and comfortable with, again, it's HPV-associated oral cancer or oral pharyngeal cancer. We're already doing these, intraoral, extraoral assessments, examinations. We're already doing it in private practice. It's just verbalizing it, getting yourself comfortable with bringing up HPV and adding that conversation into, the vaccination. And starting with the parents too, because in private practice, you see, if you're a general practitioner, you're seeing both, you may see multiple different generations of a family. So just starting that conversation and adding that, adding it to your medical history to spark those conversations after you've educated yourself.
Perfect. Thank you, Debbie. Jessica, any remaining thoughts?
Yeah, thank you, Debbie. I would say the next piece, is also for that dental practice. Once, like Debbie said, once you've got this, foundational knowledge and comfort within the dental practice, is really, like Bridget and Josh, I think I've said too, is, who is the, maybe the pediatric practice that your majority of your patients see, and really reaching out to them, right? And establishing that kind of a relationship to say, look, we are really engaging in a QI project here in our dental practice, and we are really going to be promoting and educating and encouraging patients to go to you and get their HPV vaccine. And so we just want to be aware. So if you start getting these phone calls, saying, hey, my dentist and, was just talking to me about this, like they'll know exactly and be like, yeah, we partner with that dentist. We're so glad that they brought that up with you, and let's schedule an appointment. So I think it is building those relationships, with whoever majority of those patients in that, area that you see, and really really getting the dental office on board, because it really is a special place for this conversation within the dental profession to talk about HPV vaccinations.
I do wish that in the state of Maine, we are not able to administer in the dental, like in a private practice, the dentist can't administer vaccinations, but that I just wanted to add that little in there too, because I would love to see that maybe.
Yeah, Debbie, I don't know if you want to talk a little bit more about that, because there are some states that allow, dental professionals to vaccinate. And how does that, change, I guess, the collaboration and the opportunity with HPV vaccines?
It definitely, again, just like everyone, that common thread is saying, is just building those relationships and saying, hey, during the COVID-19, there was an idea of having dentists or anyone that was certified for local anesthesia to give the vaccine. So, I mean, it's something that just should be encouraged and looked at, because again, we're seeing in the dental field, we may be seeing patients more frequently than they would their medical provider or their primary care doctor. So, being able to have that for the patient, so it's kind of, they're already in the chair ready to go, if, just to help with protection. So, I mean, I would hope that that's something that would be coming in the future, but we will see.
For sure. Karen, what would be the first step for, one of our participants to work with their school nurse?
I would contact them. Absolutely. The school nurse has multiple resources in the community to be able to share and educate parents, as well as fellow co-workers, people in the community. So definitely to contact them. For the school nurse themselves, I would say to collaborate, as everyone has mentioned, with your community. Set up that mobile vaccine clinic. We have access to 7th graders with required vaccines to come back to school. So that's a good time to catch them up with HPV if they have not had the opportunity to begin the series or finish the series. So keeping that dialogue open and educate. I can't say enough about that. I meet school nurses so often that have no idea of the details of cancer prevention with HPV. And once you explain the cancer prevention, it's so much easier to be able to share that information then with parents and be able to help them and give them resources to be able to educate themselves as well.
Perfect. I know you talked a little bit about education. Are there specific opportunities that you can think of within the school year that maybe someone could partner with the school nurse?
I'm sorry, I missed part of your question. I'm not sure about my connection.
No, it's okay. I was just asking, you talked a lot about education. Is there like particular events or times throughout the school year that maybe someone could partner with the school nurse on HPV education?
I mean, back to school is the first that we all think of because we need to have kids vaccinated before they return. But any PTA meeting, anytime you have a gathering I always think about the parents whose students are coming for a band concert or a choir concert. It's a captive audience. To just be able to set up an information table is wonderful. But again, probably back to school is the most important time, because we have requirements that have to be met, and we can tack onto those requirements with the importance of HPV.
Perfect. Thank you, Karen. Sandy, when we think about community health workers and engaging them, what would be the first step? I know, sometimes they're connected with organizations, sometimes they're not. So I guess, what are your thoughts?
I think the first thing with community health workers is providing that education. So just from my experience, just working with community health workers and doing the community health worker Echo series, is that a lot of community health workers don't have that clinical background. And so many of them are sometimes front desk staff that are wanting to get a certification. They're working in these healthcare settings, but they don't have that direct clinical experience. And so a lot of it starts with the education piece and making sure that community health workers have the proper education on HPV vaccines, the ages, and also feel equipped and ready to answer questions, because a lot of times they're out in the field, they're out at community events, and they do often get a lot of parents with a lot of hesitancies and questions. And so I think the first step is really providing that education for community health workers, because most of the people that are providing the vaccines and administrators, they've had this background, they've gone to school for this, they have this education, but community health workers often don't. And so really preparing community health workers with this information prior to sending them out into the field and having them be advocates for the HPV vaccine. But once they have that proper education, it is connecting with resources, connecting with any immunization programs within the state, connecting with the state coalition, and then also working with pharmacies as well. If they work at a clinic that has a pharmacy like an FQHC, then really working with the pharmacist on the best referral path over to the pharmacy. And if they're working with outside community organizations, it's having just really a smooth referral path, so that they're not just providing the resource, but then, like I mentioned earlier, it's really closing that loop. And then addressing those barriers to care as well. Is there a transportation need, and how can they get there? Does the pharmacy that they work with provide transportation? Do they provide vouchers? How does that all work? Because oftentimes the patients that need the community health worker assistance are often having these additional barriers that are preventing them from getting the HPV vaccines or any preventative medicine.
Perfect. Thank you so much, Sandy. We talk a lot about leadership buy-in and gaining leadership buy-in around, interventions, around doing a formal quality improvement project for HPV vaccines. So want to get your guys' thoughts, and if you could share a little bit more about how you guys gained leadership buy-in around the different, interventions you've done to increase HPV vaccines. So I'll go with Jessica and Debbie first to share a little bit more about dental, and then move from there.
Sure. So I think it's really important in the initial meetings you have within any project to make sure all the people that need to be at the table can be. I would say the most successful practices are the ones that don't have a one man, right? I was going to say one man band, but do you know what I'm saying? One person to lead this work. It's really, leadership and different levels of leadership. Also the people with the boots on the ground, right? That are giving vaccines. It's a team-based approach to care that we all look for, right, within healthcare. So really having that team on those initial conversations about the project. And really, if you can, I think it's really critically important, and I think Debbie will back me on this, dental and medical, to have a provider champion. We had a couple of dental champions that were rock stars and just embraced it, and their energy was contagious, right? So it's people like that just, keep it up. And the other thing I would say is when you're doing any type of QI project, you want to make sure that it's not like you have the kickoff, like Debbie said, we had the training and the kickoff, and then, all right, everyone, good luck. You really need to make sure that we had monthly coaching calls, right? That's where the magic happens because they're all doing the same work and you're getting them together to talk about it. So I'd say that was invaluable. And then, again, making sure that, you're collecting data. So leadership, right, really likes to see data. I think anybody likes to see data, but any type of QI project that you're putting in. So really thinking about, and different things they can look at is, in the medical side, how does their DTaP and meningococcal rates compare to their HPV? That's always eye-opening. Provider level data, sharing provider level data, not just practice level data, and also looking at missed opportunities. So, how many, eligible, right, patients came in, but for some reason it wasn't talked about. So I think all those things are really important to really think about data, think about who's at the table with leadership. And again, the provider champion, Debbie, I don't know if you want to talk about the dental champions, but they were really rock stars.
Yeah, a couple of the dentists from some of the practices just totally embraced this project and again just honed in on that cancer prevention. Again, didn't even get into any STD talk and just asked, um, have they been vaccinated? Again, looked at the age groupings versus, the 2-dose series versus the 3-dose series, but asked if they've had started the series, if they had when they had their first vaccine or second vaccine, if they need the third, would just ask follow-up questions and would refer to their patient's pediatrician or PCP. So just having that full, like as a leader, everyone can kind of hear and kind of change, like, okay, well, maybe if I ask it this way or talk about it this way, it's just, again, with that feeling more confident and just asking, and making sure everyone's on the same page. Because it can't just be, the one person asking. And then, like Jess had mentioned, so.
And I would add quickly too, just that, like Debbie said in the beginning, we had almost 700 conversations in the 2 years, and not one patient, family member ever was surprised that the dentist was talking to them, ever gave them any pushback about it, so that's really important data to talk about, because again, I think that was huge for them. They were kind of waiting for something that never happened. And I think that's really empowering for them, and it really empowered their other staff. So it's that ripple effect. So I would mention that too.
Yeah, that's really great. Jessica and Debbie, you guys made some really good points about having a provider champion, having data, making sure that you continue to have the conversation, overcoming some of those fears, right? So Josh, when we think about paramedics and HPV vaccines, how did you gain leadership buy-in, both from your organization and another organization, partnering together?
So we had the most luck with EMS systems that were hospital-based because we had either existing relationships with pharmacists at the hospital or hospital staff tends to generally be more supportive of preventive care than fire-based EMS, for example. So we definitely started with focusing on partnering with hospital-based systems, just because they tend to be more supportive of this type of thing. Um, fire, the fire-based systems are a little more interesting because in some places those leadership teams are elected, in other places they're appointed. So in some places they could be very supportive, in other places they could be very not supportive. So it really just depends. And this probably isn't the answer you want to hear, but I feel like normally you can tell in the first 2 or 3 minutes if they're going to be interested or not. I've not ever been successful in getting buy-in with someone who was not pretty immediately showing at least some interest. And I don't know if anyone has a better answer than that. I would love to hear it, but
No, that's a great point. And I think it's something that probably could be across, quite a few alternative vaccinators, right? Not just paramedics, but you want to gain buy-in from people who are really bought in, to the issue at hand. So, Bridget, love for you to just share your thoughts around gaining leadership buy-in in the pharmacy setting.
Yeah, I honestly, it's from a pharmacy standpoint, if there is interest in partnering, if there's an external partner that wants to, I would say by and large that is going to function, it's going to happen. There's not really, thankfully, a whole lot of leadership buy-in we really need to get or that we've seen now that it's just become such a common activity for pharmacists and pharmacy technicians, which is great. But I did feel like related to this and some of the comments in the chat, is sometimes it is a challenge for alternate vaccinators, pharmacists in particular, to have buy-in from other sides of the medical profession. And so we sometimes have some challenges there. And as pharmacy, we're trying to assure that we are trained, we have completed certificate programs, have to demonstrate competencies, have CEs associated with administering vaccines, and have to adhere to our state scopes of practice and protocols. So and then reporting out and making sure that, of course, happens as well. So I like to make sure that we're having those conversations to really reassure and then show that we're part of that overall team-based care for that patient. And one of the other items that we sometimes hear is that, especially the younger kids, like the 9, 10, 11-year-olds need to get in for their annual well child visits. And so we have different resources and materials that pharmacists can use to help, all right, here, mom, dad, grandma, whomever is your, VIS and the information that you receive the vaccine. Here's also a flyer that describes the importance of getting your well child visit. And I can help you identify a primary care provider in your area. And when we have those established relationships, we can really get them in more readily sometimes than we've seen others in the past. So not necessarily pharmacy leadership, but maybe some other healthcare provider types.
Yeah, no, that's great. It sounds like there's a lot of opportunity for collaboration. Want to end with one question for both Karen and Sandy. So this is our dream space question. We just got a couple of minutes left, but what would be your vision, Karen, for collaborations with school nurses when it comes to increasing HPV vaccines? And then Sandy, I'll ask you that same question.
So to kind of answer your question now and also the one prior, I think the buy-in has to come from both ways. It has to come from the school nurse. The school nurse has to be committed to want to be educating, to want to be collaborating with the community and providing mobile vaccine clinics. And they really have to be the champion. In the same sense, so does the administration from the top down, whether it be a superintendent, a principal. If the principal doesn't have buy-in for a vaccine clinic that you're providing vaccines for back to school, chances are it's going to be a flop. So I think we have to look at both sides of the picture there. And again, educating is so important. I use so many different references when I'm talking with educating school nurses through the ECHO series or one-on-one, particularly from the Roundtable, from ACS. And then I will share a link for Middle School Health, which is a great reference for parents, especially looking to get that back to school physical, as Bridget mentioned, and give them resources of what vaccines they need to go back to school.
Thank you, Karen. And then Sandy, what would be your vision for, future collaborations with community health workers and HPV vaccines?
Yeah, I think what I had touched on earlier is obviously having that education for community health workers, but I think a dream would be to have just a guidebook for every single community health worker. So working maybe specifically with the Community Health Worker Association. So working with those that are educating and training community health workers and having some of these topics talked about in those trainings. And then maybe having like a pocketbook of not just HPV, but cancer prevention in general of these are some of the guidelines, these are talking points, these are ways that you can address HPV, other cancer prevention as a community health worker. And so they can obviously take more of these courses like the ECHO series or other webinars, but that they're fully equipped or that they feel more equipped as soon as they do that first initial training. So I think maybe working with our community health worker associations on possibly a national level of having a curriculum where everybody learns about the HPV vaccine, learns about how to be HPV champions in that initial training.
Perfect. Thank you, Sandy. And thank you to all our panelists for joining today and for participating. This was a really robust conversation, and we just really hit the surface when we're talking about alternative vaccinators and HPV vaccines. So thank you again, panel, for helping to start the discussion, and we look forward to having, more conversations in the future. So we do want to hear from you as a result of today's didactic, as well as our panel. How would you rate your knowledge on the role alternative vaccinators can play with HPV vaccination efforts? And then also, which alternative vaccinators do you intend to collaborate with on future vaccination efforts? So take a minute, go ahead and share your thoughts and feedback. In the interest of time, we'll keep the poll open, and then we'll go ahead and start talking about just some resources we have for you guys. So Tina, if you want to go to the next slide. So as always, we have this really great website that we have built for all of our rural HPV vaccination learning community members to be able to access all the resources that we share during our monthly sessions. So I want to call your attention to the top of the page under important links. This is where we include recordings, slide decks from previous sessions, as well as our resource roundup. Under our monthly recordings, we put our past sessions, we put those slide decks. We also include all of the continuing education for both live and for enduring. My colleague Gabby is going to add a link into the chat for our website. And if you haven't done so already, I highly recommend that you bookmark it and so that you can access it at any time. Next up, I want to call your attention to our resource roundup. This is where we house all of the tools we referenced from our previous sessions. I'll be adding some things that were added to the chat into this resource roundup from our November session. We also added some things from our discussion in October. Next slide. In just a few weeks, we'll be wrapping up our 2024 HPV Vaccination Learning Community Series. So join us on December 4th, where we're really going to deep dive into celebrations and sustainability. So stay tuned for that. In between sessions, we hope you're actively using the information shared during the session. So as a follow-up to today's discussion, we really encourage you to start working with your QI teams to identify alternative vaccinators. You could collaborate within your community and clinic, identify interventions to implement with these alternative vaccinators. And once again, I encourage you to look at our website and look at that resource roundup that Gabby has shared in the chat. We do have another poll, and this is about future opportunities. So we do want to hear what topics you'd like to see from the rural HPV vaccination learning community in 2025. Additionally, we are going to have a new and exciting opportunity for participants who want to implement what they learned in 2024 by joining a HPV quality improvement project that will work to increase HPV vaccine rates in clinics and organizations. Participating in this program will require data sharing and monthly calls. So let us know if you're interested in joining something like this, and we will definitely reach out with more information. And we want to know how today went and what you liked and what could go better. We have a new post-session survey we're asking participants to complete to share feedback and claim CME and CNE credits. So in order to receive credit for this activity, the participant must have attended this live session and complete the program evaluation using the link that's provided in the chat. Our CME and CNE certificates will be emailed within 2 to 3 weeks of evaluation completion. And Gabby has linked that into the chat for you, or you can scan the QR code that's on this slide. For enduring CME, so this session is being recorded and will be available for enduring CME and CNE credit for those listening to this session in the future, please scan the QR code that's on this slide in particular to receive credit for this activity. For those that are doing Enduring, you must watch the content video in its entirety, answer the post-test questions, and receive a 70% or better, and complete the program evaluation. And once again, CME and CNA certificates will be emailed within 3 to 4 weeks of evaluation completion. And this session will be available for credits until November 15th of 2025. So look for that to go live on Friday. And I want to thank you all for joining today's session, and we will see you in just 3 short weeks for our December session. So have a great rest of your day.